More than 60,000 Americans died from drug overdoses in 2016. Most of them were from opioids. And the opioid epidemic is showing no signs of slowing down.
But this week, the White House and Congress took some important steps to combat this public health emergency. The U.S. Justice Department said it will join a lawsuit against drug makers that produce opioids. And a new bill would severely restrict overprescribing and provide millions of dollars to help addicts recover.
I'm excited. We have a great guest to talk about this, Dr. Paul Christo. He's an expert on the opioid crisis. Dr. Christo, first of all, looking at what's coming out of Washington, are you encouraged? Are things going to finally change?
Absolutely. I'm really encouraged by this. I mean, there are 150 opioid-related deaths per day, which is huge, and I think this bill is critical. It's critical because it will allow us to create some educational opportunities to prevent opioid addiction and to treat opioid addiction, specifically substance abuse treatment programs.
Are there specific programs on the local level that have already proven to be effective?
Well, not really, because I think nationally it's really been tough to treat addiction in general. That is, a lot of substance abuse treatment programs are way too expensive for most people to afford. And so this bill, the proposed bill, I think that will provide additional funding for substance abuse treatment programs is critical because we need to get those people into treatment.
Is it enough money, though, considering the scope of this epidemic?
Well, probably not, but it's a lot more money than we had before. I mean, you know, we really didn't have much before. At least now we've got Congress, we've got the president talking about this opioid-related crisis and this epidemic.
One side, of course, is the treatment of people who are already addicts. The other side is to try to stop it before it happens. How significant is it, in your estimation, that the Justice Department is joining this lawsuit against some of the drug makers that produce opioids?
Well, I mean, I think that it's clear that in the past we had drug makers that were pushing opioids for pain relief, and I think that was wrong. But don't get me wrong, there's a flip side of this, and the flip side is that we have 116 million Americans in the United States who suffer from chronic pain, and it's huge. I mean, it's an epidemic in and of itself. So we really still need opioids for a small percentage of patients with chronic pain who need them.
One of the turning points in the campaign against cigarette use was when the Justice Department sued the tobacco industry. Do you see parallels between the two?
Yeah, I do. I think there is a parallel there. And I mean, on the one hand, it could be pretty harsh. On the other hand, you know, maybe part of that is indicated. And I think that we need drug manufacturers who will take more of an ethical stance on dispensing, on producing medications that could have an addictive potential. Because I think that's what happened here. And I think that a lot of that was ignored in the past.
Dr. Christo, for our viewers who may be thinking, oh my goodness, I have a family member, I know somebody who seems like they're getting addicted to opioids, what should they do to try to help that person?
Well, first and foremost, I would talk to the patient's primary care doctor, express that particular concern, and then if need be, seek out the treatment of an addiction medicine specialist, because it's that person, that specialist, who can go through the criteria that we use to determine if a patient or if a person suffers from the disease of addiction.
Yeah, and there are a lot of Americans that certainly suffer from the disease of addiction, and it's not only opioids, now it's turning to heroin. So I've asked you this in the past before, but all of these moves by the Trump administration, is it too late considering now people are hooked on heroin?
I don't think it's too late. I don't think it's ever too late because I'm happy that we have additional funding that's going to target the opioid epidemic that's related to heroin as well, because we've seen more and more people turn to heroin on the streets. And I'm not sure if I mentioned this before, but a lot of the heroin now is laced with high potency opioids like fentanyl and carfentanil. And when that happens, boy, I mean, the risk of death is even higher.
Yeah, it's a very big issue in the United States, and I'm glad we got some insight from you on that. Dr. Paul Christo, a pain management expert and author of Aches and Gains, thank you for your time.
Thank you.